Okay, let's discuss the 5 transporting points. The Jingwell points, bladder 67, reaching yin. Bladder 67, location on the dorsal aspect of the little toe, 0.1 tune from the lateral corner of the nail. How to find this point is located at the junction of 2 tangents that border the nail of the little toe laterally and proximally, approximately 0.1 tune from the actual corner of the nail. Needling vertically 0.1 tune or obliquely 0.2 tune in the direction of the foot. Prick to bleed. Caution, painful joint. For the action indication, bladder 67 is scientifically established the conversion of breech presentation prior to birth. Moxibustion and electroacupuncture at this point seem to be most effective, approximately 70 to 80%. It also facilitates labor. It expels pathogenic factors from the opposite end of the channel and regulates yin and yang of the water element. Special features, bladder 67 is a Jingwell point, metal point, tonification point, exit point. An isolated case has been reported regarding a pregnant woman who was treated with moxibustion of bladder 67. This resulted in a fetal-maternal transfusion of 300 ml of blood, endangering the fetus. For this reason, treatment should be controlled by cardiotopography. As a well point, bladder 67 eliminates wind, both interior and exterior, and is frequently used for the headache from exterior or interior wind. Being the end point of the channel, it can be used to affect the opposite end, and it is therefore used to clear the eyes. For such symptoms as blurred vision or pain in the eye, usually from wind. It is used empirically for malposition of the fetus. This is normally done in the 8th month of pregnancy, burning 5 Moxa cones in each side once a day for 10 days. Bladder 67 subdues rebellious chi from the head, those having headache, dizziness, occipital headache, neck ache. It also clears heat, those having red eyes, eye pain. It resolves damp heat, those with difficult urination, painful urination, and also promotes labor. Those having retention of placenta, malposition of fetus, delayed labor, prolonged or difficult labor. Bladder 67 is the Jingwell and metal point of the bladder channel. Unlike most of the other 11 Jingwell points, however, it has no apparent classically recorded action of restoring consciousness in case of coma or collapse, and is similarly to the other Jingwell points is limited to its ability to clear fullness and heat from the opposite end of the channel in the head. The spiritual pivot states the diseases of the head select points from the feet, while Song to Keep Up Your Sleep says that bladder 67 is indicated for disorders of the face and head. Bladder 67 is particularly applicable for vertex and occipital headache, whether due to exterior pathogenic wind or to internal disharmony, as well as for disorders of the neck, eyes, nose, and ears. As the terminal point of the bladder channel, bladder 67 is especially dynamic in its action and in clinical practice would be considered when these disorders are acute rather than chronic in nature. The principal application of bladder 67, however, is the treatment of malposition of the fetus, for which it is renowned. For this purpose, it is treated by stick moxibustion for 15 to 20 minutes bilaterally, or by Moxa cones, 5 to 10 cones at each point, once or twice a day. The woman should lose her clothes and sit in a comfortable semi-reclining position. It is common practice in China to demonstrate this method to the pregnant woman, who is then supplied with Moxa sticks for self-treatment at home. Best results are achieved if this treatment is started in the 34th week. It is important to note that once the fetus has turned, moxibustion should be discontinued. Otherwise, further malposition may be induced. The effect of bladder 67 on the uterus extends further to inducing delayed labor, hastening the delivery once labor has commenced, and promoting the expulsion of the placenta after childbirth. It is interesting to note that despite the intimate relationship between the kidneys and the uterus, it is point of its coupled bladder channel, especially bladder 67 and bladder 60, rather than points of the kidney channel, which have the action of promoting labor. According to yin yang theory, yang is activity, yin is quiescence. Yang brings forth and yin develops. And when yin reaches its maximum, it will necessarily transform into yang. The yin of the kidney nourishes and dominates the development and growth of the fetus through the long months of pregnancy. As the birth date approaches and yin reaches its zenith, yang must begin to grow in order to turn the fetus and prepare for the intense activity of birth. If towards the time of delivery, there is insufficient yang activity of the uterus due either to deficiency or stagnation, then yang must be stimulated. Bladder 67 is the terminal point of the yang bladder channel, where the qi changes polarity and enters its coupled yin kidney channel, reflected in its name, ZHIYIN. It is the most dynamic point to achieve the uterus and hence turns the fetus and promote labor, especially when stimulated by the yang heat of moxibustion. Finally, bladder 67 is one of the few distal points on the bladder channel indicated for disorders of urination. In this case, painful urinary dysfunction and difficult urination. Clinically, however, distal points of the bladder channel are rarely used for this purpose. Thank you for your attention.
Let's talk about REN15, turtle dovetail, Sorsion point. REN15 is located on the anterior midline, 1 sun, inferior to the sternocostal angle, or 7 sun, superior to the umbilicus. How to find REN15? The distance between the sternocostal angle and the center of the umbilicus is divided into 8 sun, which can vary considerably from the patient's fingered sun. Therefore, only proportional sun measurement should be applied here. A helpful device would be an elastic tape. From the sternocostal angle, measure 1 sun in an inferior direction and there locate REN15 on the anterior midline. It is often located directly below or, depending on individual anatomy, on the xiphoid process. Needling 0.5 to 1 sun obliquely in an inferior direction. The patient should be in an extended position. Caution should be observed because there is possible injury to organs with deep needling or oblique insertion in a superior direction, especially in patients with hypertrophied organs. Left, we have the liver. On the right, we have the heart. According to some classical texts, moxibustion is contraindicated. Actions, indications of REN15. Regulates the heart, calms the shen, descends counterflow, lung and stomach qi, unbinds the chest, regulates the luo-connecting vessel of the REN mind. Special features of REN15, luo-connecting point of the REN mind. Important point for calming. REN15 is a very important and powerful point to calm the mind. According to Chapter 1 of the Spiritual Axis, it is the source point of all the yin organs, which means that it affects the original qi or yuan qi of all yin organs. REN15 nourishes all yin organs and it calms the mind, particularly deficiency of yin in our blood. It is a very powerful calming action in severe anxiety, worry, emotional upsets, fears, or obsessions. Although its indications show that it can be used to open the mind's orifices in serious mental conditions. From a full condition, we use this point in mental emotional states occurring against the background of blood or yin deficiency. REN15 has an important influence on the chest. It opens the chest and promotes descending of qi. A useful aspect of this action is that REN15 promotes descending of both lung qi. So this is very good for cough, wheezing, breathlessness, and heart qi. Anxiety, sighing, feeling of oppression of the chest. The connecting channel of the directing vessel starts at REN15, which controls it. From this point, the connecting vessel branches out in numerous small branches, fanning out over the abdomen. When the connecting vessel is empty, there is itching of the abdomen. When it is in excess, there is pain of the abdomen. REN15 can be used for empty or full conditions of the connecting channel. REN15 is located at the tip of the xiphoid process, which is commonly known as dovetail in China, hence the name of the point. Calms the mind, it opens the mind's orifices, as in manic depression, palpitations, anxiety, and insomnia. Opens the chest and promotes the descending of qi, fullness and pain of the chest, wheezing, breathlessness, a feeling of oppression of the chest, sighing, and cough. REN15 is the luo connecting point of the conception vessel, from where the qi of this channel disperses and spreads down over the abdomen. The name of REN15, turtle dovetail, reflects the shape of the xiphoid process, likened to the tail of a dove, with the ribs forming the wings. In fact, historically, there has been some discussion as to whether REN1 rather than REN15 is the luo connecting point of the conception vessel. The spiritual pivot refers to the luo connecting point of the conception vessel as tail screen, an alternative name for REN15, and gives symptoms of excess, pain of the skin of the abdomen, and deficiency, itching of the skin of the abdomen. Later classics, including both the systematic classic of acupuncture and Moxibustion and the great compendium of acupuncture and Moxibustion, refer to the luo connecting point of the conception vessel as flat screen, an alternative name for REN1, and ascribe the symptoms of excess and deficiency to that point. REN1 rather than REN15 as the luo connecting point of the conception vessel would reflect a neat symmetry with DU1 as the luo connecting point of the governing vessel. Like REN13, the frontline point of the heart, REN15 has a powerful action on calming the spirit in cases of phlegm obscuring the heart, epilepsy, mania disorder, mad singing and walking, and aversion to the sound of people talking, as well as regulating stagnation of qi and blood in the heart region, giving rise to oppression and pain. Also, like REN13, REN15 is able to regulate and descend lung qi in cases of wheezing, cough, dyspnea. In the spiritual pivot, REN15 is listed as the yuan point of the calm. This term, the same calm as in bladder 43, refers to the area below the heart, whilst Wang refers to the area above the diaphragm. It is said that when a disease enters the Kao Wang, it is difficult to cure. Master Zhuo Chu's tradition of the spring and autumn annals, one of the earliest textual references to acupuncture, describes how, when the Prince of Jin was gravely ill, he sent for the famous doctor Yi Huan. After examining the patient, Dr. Huan declared that the disease had settled in the Kao Wang region between the heart and the diaphragm, and hence it cannot be purged. It cannot be reached by needling herbs will not penetrate it, there is nothing to be done. Despite the statement by the spiritual pivot, which implies that the cow originates at REN15, this point is not normally understood to treat deep and chronic deficiency diseases. The only relevant indications being diminished qi and excessive sexual activity leading to exhaustion in youths. Thank you for your attention.
We continue with the connecting loop points. Liver 5, woodworm canal. Liver 5 location on the medial aspect of the lower leg, 5 June proximal to the highest prominence of the medial malleolus. Just posterior to the medial crest of the tibia, between the crest of the tibia and the gastrocnemius muscle. How to find? First, locate the highest prominence of the medial malleolus. From there, palpate 5 June in a proximal direction, and there locate liver 5 in a depression directly posterior to the medial crest of the tibia. Or quick method, divide the distance between the medial end of the popliteal crest and the highest prominence of the medial malleolus, approximately 15 June, into thirds, and locate liver 5 a third of the distance from the medial malleolus. Note some texts locate liver 5 on the tibia, others on the posterior border of the tibia. Sensitivity to pressure should be determining factor. Kidney 9 is located on the same level but directly superior to kidney 3, between the medial malleolus and the Achilles tendon. Needling liver 5.5 to 1 June vertically or obliquely in a posterior direction towards the fibula or transversely subcutaneously along the tibia towards the abdomen. Action and indication: liver 5 regulates liver qi, benefits the genitals, clears damp heat from the lower burner, regulates menstruation. Liver 5 eliminates plum heat qi and moves qi locally. For the special features, liver 5 is the loo connecting point, important distal point for the urogenital region, especially with liver qi stagnation and damp heat. Liver 5 has specific affinity for the genital and urinary area. The liver connecting loo channel departs from this point and flows up the inner aspect of the thigh to encircle the genitals. This point can therefore be used for any urinary symptoms deriving from stagnation of liver qi, such as distension of the hypogastrium, distension and pain before urination, and retention of urine. It resolves dampness in this area and is therefore used for hernial and genitourinary disorder with such symptoms as vaginal discharge, cloudy urine, swelling and pain of the vulva, pain in the scrotum, etc. Besides influencing the genital area, this point also affects the throat and issues for stagnation of liver qi in the throat, causing the typical sensation of lump in the throat and of being unable to swallow. This sensation is related to emotional tension, and it comes and goes according to the emotional state. It is called plump stone syndrome in Chinese medicine, as the person feels as if he or she has an obstruction in the throat. It also promotes the smooth flow of the liver qi, hypogastric distension, abdominal distension, resolves damp heat in the genitourinary system, hernial and genitourinary disorder, itching, swelling, and pain of genitals, swelling and pain of the testicles or vulva, priapism, persistent erection, abdominal fullness, difficult urination, retention of urine. According to the spiritual pivot, the liver governs the sinews, while the essential question says the genitals are the gathering place of the sinews. The liver primary channel encircles the genitals, and the liver sinus channel and the liver loo connecting channel from liver 5 ascend to the genitals. Liver 5 is the loo connecting point of the liver channel, is a major point for treating diseases of this area, and is indicated for itching, swelling, and pain of the genitals, and sudden pain and swelling of the testicles due to both liver qi stagnation and damp heat in the liver channel. Liver 5 is also indicated for inessant erection priapism. The liver belongs to wood and spring, which manifests the energy of growth, spreading and ascending, and is entrusted with ministerial Mingmen fire, which has its source in the kidneys. Normal erection is dependent both on the flourishing of the kidneys and harmony of the liver. Incessant erection may arise either in the springtime of adolescence, when the kidney essence becomes abundant and the liver is exuberant, in which case it may be embarrassing but is not considered abnormal, or when pathological flaring of liver fire agitates and inflames the penis, in which case it is pathological and distressing condition. Liver 5 is one of the few points specially indicated for this disorder. The ability of liver 5 to clear liver qi stagnation and damp heat extends to the lower jaw as a whole and is indicated for red and white leukorrhea, Shan disorder, distension of the lower abdomen, qi accumulation below the umbilicus like a stone, prolapse of the uterus, difficult urination, and retention of urine. In common with many of the Lu connecting points, especially of the yin channels, liver 5 treats a variety of psycho-emotional disorders. The liver channel ascends to the throat, and according to the number of classics, including Great Compendium of Acupuncture and Moxa, liver 5 is indicated for worry and oppression, stuffiness in the throat, as if obstructed by polyp. This refers to what is more commonly known in Chinese medicine as plum stone globus hystericus, a sensation of physical obstruction that fluctuates according to a person's mood. Plum stone qi is most commonly due to stagnation of liver qi and accumulation of phlegm. Liver 5 is further indicated for depression, pride palpation, palpitation, and fear and fright. These latter indications reflecting the statement of the spiritual pivot: when liver qi is deficient, there is fear. The liver stores the blood, and the smooth flow of blood depends on the free flowing of liver qi. The liver, therefore, has a close relationship to the menstrual cycle, and liver 5 is able to treat menstrual disorder such as dysmenorrhea and irregular menstruation due to qi stagnation or blood stasis. Due to its ability to treat depression, it is specially indicated when the symptoms accompanies menstrual disorders. The liver has the function of both spreading the qi and nourishing the sinews. It is interesting to note that in common with several other points of the liver channel, liver 5 is indicated for inflexibility and pain of the lumbar region, reflecting the clinical importance of liver pathology. Liver 2 in some disorders of this area. Finally, the Great Compendium of Acupuncture and Moxa gives specific indications for excess and deficiency of the Lu connecting points. In this case, liver 5, these are persistent erection, excess, sudden itching of the genitals, deficiency. Thank you for your attention.
Let's discuss bladder 24, CO Qi, a backshoe point. Bladder 24 is located 1.5 Sun lateral to the posterior midline on the level of the lower border of the spinous process of the third lumbar vertebra. How to find bladder 24? For orientation in the lumbar region, first determine the Tonification line. Place both hands directly superior or lateral to the highest points of the iliac crests, joining the thumbs on the midline at the lumbar spine. In most cases, this line intersects with the spinous process of L4. This varies depending on the patient's position. From there, count upward to the lower border of the spinous process of lumbar 3, and on this level, locate bladder 24, 1.5 Sun in a lateral direction. Located on the same level are a point of extra point B2, which is 0.5 tsum lateral to the midline, and extra point B5, 3 tsum lateral to the midline, according to the WHO location notes. Bladder 24 is needled vertically 0.5 to 1.5 tsum. Actions or indications. Bladder 24 benefits the back and strengthens the knees, regulates and tonifies chi and blood of the lower burner. Bladder 24 is not a major point in terms of its energetic action, but it is frequently used as a local point in chronic or acute lower back ache. Apart from this, it also invigorates blood and eliminates stasis in the lower burner, and is therefore used for uterine bleeding and irregular menstruation. Despite its evocative name, Sea of Chi Shu, Bladder 24 is credited with no tonifying or chi regulating properties, and in clinical practice is mostly used, especially when tender, in the treatment of lumbar pain. Bladder 24 strengthens the lower back ache, stiffness of the lower back, painful obstruction syndrome, or P syndrome of the legs, regulates menstruation for painful periods, irregular periods, leukorrhea, invigorates blood for hemorrhoids, bleeding hemorrhoids, blood in the stools. Combinations for lumbar pain, we would add bladder 23 and bladder 29 to bladder 24. Bladder 24 is located directly behind REN6, or the Sea of Chi. It is named for its location and similar, though less potent properties. It is used to tonify chi and blood. It also strengthens the lower back and knees and is used as a local point. Removes obstructions from the channel and is used in lower extremity paralysis. Regulates chi and blood and moves stasis, and so is used in deficiency conditions of irregular painful menstruation or uterine bleeding, also used for hemorrhoids. Consider bladder 24 for general weakness of the system, lower back problems, irregular or painful menstruation or hemorrhoids, and similar in its effect to REN6 or the Sea of Chi. Thank you for listening.
We continue with the large intestine channel, the primary channel. The large intestine channel starts from the tip of the index finger. It then runs along the radial side of the index finger and up the lateral anterior aspect of the arm. It then reaches the shoulder at the point LI15. From here, it connects with DU14 and descends to the supraclavicular fossa to enter the lung. From the supraclavicular fossa, it ascends along the sternocleidomastoid muscle to the cheek and enters the gums of the lower teeth. It then curves around the philtrum and crosses over to end at the side of the nose where it links with the stomach channel. Overview of the large intestine points. It affects the arm, shoulder, neck, and head. Expel exterior wind, treat the face and sinuses. Many points dissipate nodules and treat goiter. The large intestine primary channel pathway, the external part of the large intestine primary channel begins on the index finger, LI1, at the radial aspect of the corner of the nail. This point is reached by a branch which separates from the lung primary channel at lung 7, Han-Jiang-Min connection of the first grade circuit. The large intestine primary channel runs between the first and second metacarpal bones, then runs proximally along the radial aspect of the forearm towards the lateral aspect of the elbow. Travels in a proximal direction along the lateral aspect of the upper arm towards the shoulder. Crosses the small intestine primary channel at SA12 in the center of the suprascapular fossa. Continues to DU14 inferior to the spinous process of the 7th cervical vertebra where it meets with the other 5 young primary channels, crosses the neck and enters the supraclavicular fossa at stomach 12. Here, the internal pathway branches off and connects with the lung. It's paired some organ, penetrates the diaphragm and enters the large intestine. It's pertaining to organ. From the large intestine, according to some authors, the large intestine primary channel, an internal branch, runs in an inferior direction to stomach 37 on the lateral aspect of the lower leg, the lower hesi point of the large intestine. The external branch ascends from the supraclavicular fossa, travels along the lateral aspect of the neck, and traverses the cheek. From here, another internal branch enters the lower gums, where it extends farther. The external course of the primary channel passes stomach 4 and curves around the mouth to the upper lip, crossing to the contralateral side of the body at DU20, located at the philtrum. On the contralateral side of the body, it reaches LI19 and terminates contralaterally at LI20 on the side of the nose. Note, Deadman et al. 1998 mentioned REN24 as additional meeting point variant figure. They also mentioned GB5, GB6, GB14 as a classic meeting points for the large intestine channel, but these are not normally shown in illustrations of the channels. Clinical importance, exterior signs and symptoms: fever, dryness of the mouth, thirst, a sore and swollen throat, nosebleed, toothache, red, painful eyes, stiff fingers, painful cold, or painful hot swelling of the upper arm and shoulder. Interior or punctal organ signs and symptoms: pain in the lower abdomen, vertiginous, diarrhea or yellow stools with mucus, shortness of breath, dyspnea. Excess heat sensation along the channel, deficiency, cold sensation, and chills along the channel. Connections of the large intestine primary channel with other channels. Lung primary channel connection, Han-Yin-Yang connection of the first great circuit. Location, lung 7, LI1 on the hand. A branch of the lung primary channel connects with the large intestine primary channel at LI1. Circulation, circadian, according to the organ clock. Importance, exterior-interior relationship. Stomach primary channel connection paired according to the 6-channel theory. Hand-foot pairing, yang axis of the first great circuit. Location, LI20, bladder 1, stomach 1 on the head. Circulation, circadian, according to the organ clock. Importance, above-below relationship. With the punctal organ system, lung, large intestine, stomach. Here, the illustration, it passes through SI12 to DU14, connects with the lung, and descends the large intestine. So this is the large intestine primary channel, connects with the large intestine and lung. Thank you for your attention.
Let's talk about body tune for location methods and tune measurements. Body tune or proportional tune, the most commonly used proportional distances. Tip for locating the end of the axillary fold. The anterior or posterior axillary fold defines the end of the axilla, forming a fold in the skin, both anteriorly and posteriorly, where the arm joins the thorax. The axillary fold is the reference point for any tune measurements on the upper arm, which can be found by asking the patient to adduct his or her arm and to insert his or her flat hand into the axilla. The end of the axillary fold points in a superior direction, terminating at the lower border of the pectoralis major muscle, which in this area extends to its insertion in the humerus, below the deltoid muscle. The end of the axillary fold may vary considerably depending on the individual proportions, positioning of the arm, and flexing of the muscles. It should therefore be located with the patient's arms hanging down in a relaxed way. So here we can see the different uses of the tsun, of the body tsun. Okay, so first we have the landmarks for the suprasternal fossa, the sternocostal angle, the end of the axillary fold, cubital crease, wrist joint space. Okay, we also have the center of the umbilicus, upper border of the pubic symphysis. Another one would be the upper patellar border, the transition shaft or the medial condyle of the tibia, the highest prominence of the medial malleolus, highest prominence of the lateral malleolus, highest prominence of the greater trochanter, popliteal crease. Okay. Wrist joint space, the gluteal crease. So these are actually the landmarks where we take the body tsun or the tsun measurements. Okay, so to be very detailed about it, we have from the longitudinal, let's start with the head. Longitudinal, we have 12 tsun. This is from the anterior to the posterior hairline. From the midpoint of the eyebrows to the anterior hairline is 3 tsun. From the lower border of the spinous process of C7 to the posterior hairline is 3 tsun. From extra head neck 3 or the yin tang to DU14 is 18 tsun. Horizontally on the head, the distance between the mastoid processes is 9 tsun. From the corner to the corner on the forehead, which is stomach 8 to stomach 8, is 9 tsun. For the thorax and abdomen, longitudinal, from the suprasternal depression, from REN22 to the sternocostal angle, the xyphosternal synchondrosis is 9 tsun. From the sternocostal angle, xyphosternal synchondrosis to the center of the umbilicus is 8 tsun. From the center of the umbilicus to the upper border of the pubic symphysis is 5 tsun. Horizontally, the distance between the two nipples is 8 tsun. Laterally longitudinal, from the end of the axillary fold to the tip of the free end of the 11th rib, liver 13, is 12 tsun. Back and lumbar region. Both the spinous processes and the intercostal spaces are used for orientation. Main reference points are the spinous process of C7, the inferior angle of the scapula level with T7, the iliac crest level with the spinous process of lumbar 4, the posterior superior iliac spine, PCs, level with S2 or the second sacral foramen. Please note the position of the patient, standing, sitting, or lying, as well as individual anatomy and spinal structure, kyphosis or lordosis, they all influence the level of the vertebrae, which consequently may vary considerably in relation to other anatomical structures. So longitudinally, from the spinous process of T1 to the tip of the coccyx is 30 tsun. Horizontally, from the medial border of the scapula to the posterior midline, the spinous processes with the shoulder, relaxed and hanging arms is 3 tsun. Upper extremity. So laterally, from the end of the anterior axillary fold to the transverse cubital crease is 9 tsun. From the transverse cubital crease to the wrist joint space, the transverse wrist crease is 12 tsun. Lower extremity. So we have lateral, from the highest prominence of the greater trochanter to the popliteal crease is 19 tsun. From the popliteal crease to the highest prominence of the lateral malleolus is 16 tsun. From gallbladder 34, anterior and inferior to the head of the fibula to the highest prominence of the lateral malleolus is 14 tsun. From the highest prominence of the lateral malleolus to the lower border of the heel is 3 tsun. Medial. still at the lower extremity. From the upper border of the pubic symphysis to the upper border of the patella is 18 chun. From the medial end of the popliteal crease to the highest prominence of the medial malleolus is 15 chun. From the medial condyle of the tibia, junction of the head and the shaft of the tibia to the highest prominence of the medial malleolus is 13 chun. From the gluteal crease to the popliteal crease, so this is dorsal, we have 14 chun. And finally, the difference between the medial and lateral malleolus. The difference between the level of the highest prominence of the lateral and medial malleolus, respectively, is 1 chun. Thank you for your attention.
We continue with the 4 C's, do 20 by who, 100 meetings. Location, do 20 at the junction of a line connecting the apices of the ears and the midline. 5 chun from the anterior or 7 chun from the posterior hairline, respectively. How to find spreading the hands technique. Place the hands on both sides of the head with the little finger touching the apices of the ears. Join the thumbs on the midline and locate do 20 in a shallow depression on the vertex of the head. Alternate location method, use an elastic tape. With the midpoint marked on it, the symbolic compartment of 220 as the highest point on the body and in contact with heaven is kidney 1, the lowest part of the body and in contact with the earth. Needling 0.5 to 1 chun transversely, subcutaneously towards the posterior, reducing effect, or the anterior, tonifying effect. Caution, apply pressure to head points after needle removal to avoid bleeding. Remember to remove the needle after treatment. For the action indication, it calms wind, pacifies yang, benefits the brain, sensory organs, calms the shen. Nourishes the sea of marrow, applying moxibustion raises the yang. For the special features, meeting point with the GB, bladder, and trifle burner and liver channel. Sea of marrow point. Important point for descending of the yang, reducing needle techniques, or raising the yang, tonifying the needle techniques, moxibustion. Do 20 is at the vertex of the head, the place of maximum potential of energy, and also the convergence of yang channels. For this reason, it has a dual function as it can either expel excess yang from the head or promote the rising of yang to the head. Do 20's action in extinguishing interior wind and subduing liver yang is related to its first function. For this reason, this is an important point for headaches from liver yang rising or liver wind. Do 20 is a meeting point of many yang channels, which carry clear yang to the head. It therefore has a powerful effect in stimulating the ascending of yang. When used with direct moxa, it stimulates the ascending of clear chi to the head, and is therefore used for prolapse of the internal organs such as stomach, uterus, bladder, anus, or vagina. It's specially indicated for prolapse of the anus, which lies in the governing vessel pathway. Do 20 is effective not only in actual prolapse, but also for incontinence of urine, very frequent urination, and generally sinking of chi with a feeling of bearing down in the lower abdomen. When using this point with moxa to raise the yang, caution must be exercised to make sure that there are no heat symptoms at all. Also, this point should not be stimulated with moxa if the person suffers from high blood pressure. This point lifting action of yang has a mental effect in that it promotes the rise of clear yang to the brain and the mind. Do 20 has a powerful effect in lifting depression and clearing of the mind. Finally, it promotes resuscitation when the person is unconscious, especially combined with do 26 and PC6. Do 20 extinguishes internal wind like wind stroke, hemiplegia, opistotonus, loss of consciousness, epilepsy. It subdues the liver yang, those with headache, dizziness, tinnitus, blurred vision. It raises the yang, those with prolapse of internal organs, stomach, uterus, bladder, prolapse of anus. Benefits the brain and the sense organ, those having dizziness, brain noise, tinnitus, poor memory, nasal obstruction, nasal discharge, nosebleed, and blurred vision. It also lifts the mind, those having depression, and promotes resuscitation, those with loss of consciousness. The name DU20 100 meetings reflect the location of this point at the crown of the head, which is the meeting of all the yang qi of the body and its ability, according to the classic of supplementing life with acupuncture and moxibustion, to treat the 100 diseases. Like many acupuncture points, DU20 has also been given a variety of alternative names in classical texts, reflecting different aspects of its nature. The name 3-yang-5 meetings emphasizes that DU20 is the meeting point of the governing vessel with the 3 yang channels of the bladder, gallbladder, and shankiao, as well as the liver channel. Another name, mud ball place, is used in Qigong theory. Mud ball refers to the material aspect of the spirit which is located in the brain. And accordingly, DU20 is sometimes considered to be the location of the upper Danchan Cinnabar field. Further names include Mountain of Heaven, reflecting its location at the highest point of the body, and Women Ghost Gate, reflecting its influence on psycho-emotional disorders. Finally, according to the spiritual pivot, DU20 is listed as one of the group of 25 points for treating headache caused by inversion qi, disordered and contrary flow of qi. DU18, DU19, DU20, DU21, DU22, bladder 5, bladder 6, bladder 7, bladder 8, bladder 9, GB15, GB16, GB17, GB18, GB19. Thank you for your attention.
Let's talk about the 4 levels. The conclusion for common cold and influenza. Once the pathogenic factor penetrates into the interior, the body's qi carries on its fight against it in the interior. This causes a high fever and a feeling of heat, in marked contrast to the aversion to cold and the shivering that occur when the body's qi fights the pathogenic factor on the exterior. At the exterior level, the internal organs are not affected, and it is only the lungs' defensive qi portion that is involved. When the pathogenic factor becomes interior, the organs are affected, and especially the lungs and the stomach. This stage of development in the pathology of these diseases is crucial, as if the pathogenic factor is not cleared, it may either penetrate more deeply and cause serious problems at the nutritive qi or blood level, or give rise to residual heat that is often the cause of chronic post-viral fatigue syndromes. In the interior, the main patterns appearing will be either the bright yang pattern of the 6 stages, or more commonly, one of the qi level patterns within the 4 levels. In general, at the qi level, either the stomach or lung or both are affected. Exterior wind heat penetrates via the mouth and nose. The mouth opens into the stomach and the nose opens into the lungs. If wind heat is not expelled while it is in the upper burner, it will penetrate into the middle burner. The bright yang channel and bright yang organ patterns of the bright yang stage are exactly the same as stomach heat and stomach and intestines dry heat of the qi level, respectively. For this reason, We shall refer to both the bright yang stage of the 4 stages and the chi level of the 4 levels as chi level. The lesser yang pattern of the 6 stages is nearly but not quite the same as the gallbladder heat pattern of the 4 levels. So we have here a table comparing wind cold and wind heat. Pathology: wind cold obstructs the defensive chi. Wind heat injures defensive chi and impairs descending of lung chi. Penetration of pathogenic factor in wind cold is via the skin. In wind heat, via nose and mouth. Fever is light in wind cold, high in wind heat. Aversion to cold is pronounced in wind cold, slight in wind heat. Body aches are severe in wind cold, slight in wind heat. Thirst, none in wind cold, slight thirst in wind heat. Urine is pale in wind cold, slightly dark in wind heat. Headache is occipital in wind cold, whole head in wind heat. Sweating, no sweating or slight sweating on the head in wind cold, slight sweating in wind heat. No change in the tongue for wind cold, slightly red on the sides and or the front for wind heat. Floating tight pulse for wind cold, floating rapid pulse in wind heat. To put the 4 levels in a nutshell, one could say, at the defensive chi level, there is aversion to cold. Chi level, aversion to heat. Nutritive chi level, fever at night, red tongue without coating. Blood level, bleeding and maculae. The ideal is, of course, to stop invasion of exterior pathogenic factor at the beginning stages. This is not always possible for various reasons. Our treatment may not always be the right one. The patient may not take care during the acute invasion. The unnecessary use of antibiotics may aggravate and prolong the condition, or the disease may be a warm disease that cannot be halted completely at the beginning stage in any case. Finally, we may not see the patient until the pathogenic factor is already in the interior. Even if for any of the above reasons we cannot stop the invasion at the exterior stage, it is still important to stop it at the chi level, as at this level, the condition can become chronic and lead to the development of post-viral fatigue syndromes or chronic fatigue syndromes. So here we have a flow chart for the bright yang, lesser yang, and chi level patterns. So as you can see, under 6 stages, bright yang, we have the channel and organ pattern. For channel pattern, this corresponds to stomach heat, organ pattern, stomach, intestines, dry heat, and of course the lung heat. So all of this will be found at the chi level. For the lesser yang, leads to gallbladder heat, still at the chi level, and stomach, spleen, damp heat, chi level. Thank you for your attention.